name is Erin Anderson, and I'm the Director of Programs and Advancement for the Autoimmune Hepatitis Association, and I'm also a patient with AIH. And today I have the pleasure of facilitating our patient panel. Before we get started with that, I just wanted to note that there are 130 participants on the call this morning. We weren't sure how many people would show up, and it's really exciting to see so many of you all here today. And when you have a rare disease, it's easy to feel alone. And I just want to let you know you are not alone. There are over 100 other people on this call who also either have this disease or have a family member who has this disease. I also wanted to give a quick plug for our virtual support groups. If you haven't attended one before, I would really highly encourage you to consider joining one. It's an opportunity to get to know other members with this disease and share stories and your experiences. And it's just a wonderful form of support, as some of you have already experienced. Feel free to send me an email at info@aihep.org if you'd like to attend an upcoming meeting. We have the groups divided by geography, and so we'll connect you with the one for your area with the hopes that maybe eventually we would be able to have an in-person local support group meeting. Before we get started with our panelists who are here today, if you could go ahead and turn on your video and unmute yourself, that would be great. We have Carrie, Aricia, and Carol Joyce with us. I would like to go ahead and ask each of them to give a very brief 30-second introduction of themselves. If you could just tell us your name and some background information, how long you've had the disease, and maybe how you came to be diagnosed. Again, very quick so we can move on to some of our other questions. Carrie, would you like to get us started?
Sure. Hi, everyone. Thanks, Erin, Dr. Lambert. So far, this has been great. I've been living in Atlanta, Georgia for about 30 years, but I'm from Nashville, Tennessee, which is a big difference. I have had AIH for 4.5 years, and I found it came through with just a routine physical. My AST and ALT were elevated, and I went through and had the ANA test and a biopsy, which showed some fibrosis. And, we diagnosed it within about 2.5 months. So that's kind of my story.
Thank you, Carrie. Aricia, are you on the call with us? I saw you before on the call, but I'm not seeing you now. Are you here?
I am.
Oh, there you are. Perfect. There's so many people on the call. It's hard to keep track of where everyone is. So fantastic. Would you like to introduce yourself and tell us a little bit about your story with the disease?
Yes. Hi, good morning, Erin and Dr. Lambert and everyone out there. My name is Aricia McCrae. I am actually a registered nurse. I was diagnosed around 2017. I was diagnosed with blood work and also a liver biopsy.
Thank you, Aricia. Carol, would you like to introduce yourself? Carol, are you muted? You might need to unmute yourself. Let's see.
Okay, now I'm on.
Oh,
Thank
perfect.
you.
There you are.
Okay. My name is Carol Joyce, and I have been under treatment for AIH for the last 2 years, but I was tentatively diagnosed way back in 2014 when, again, a routine blood test showed moderately elevated ALT and AST, and I went the round of the gastro and the hepatologist, and in 6 months, all on their own, they went down very nicely. So it was the best guess of everyone it was a drug-induced liver injury from an over-the-counter herbal supplement that I had gotten from a general nutrition center. 5 years was fine. Then I was put on a cholesterol med, fine for almost a year. Then they went back up again. This time the ultrasound was not quite as unremarkable as the one I had in 2014. And so I was again being watched because I was completely asymptomatic and the levels were not that high, and I was getting tests. They were again coming down nicely. Well, that was in August of 2019. And then, of course, March 2020, everything went sideways for everybody. I couldn't be monitored. I don't know if it's a combination of stress, not being monitored, but in August of 2020, I was feeling ill, sent to the emergency room. ALT and AST were in the thousands. And at that point, I was put on treatment and immediately given a biopsy. And for the last 2 years, I have been actively dealing with AIH. But there were several years before when it was kind of vague, So
And I think that's one of the challenges of having a rare disease is getting that definitive diagnosis. And we've heard that a lot from members. One thing that always comes up in our support groups, everyone wants to know what medications everyone else is on. So if each of you wouldn't mind just sharing what medications you take for AIH, that would be great. Carol, do we want to go back to you?
I am currently on, have clawed my way down to 2.5 milligrams of prednisone from 60 2 years ago. And I am on 2,000 milligrams of Celsius, and keeping my fingers crossed at this time, no relapses.
Thank you. Aricia, would you be willing to share what you currently take for AIH?
Yes, currently for AIH itself, I take prednisone. I am on 30 milligrams, yes, still, and been slowly trying to wean myself down. Well, my doctor's been slowly trying to wean it down from my last hospital visit. I am also on tacrolimus. I was on 6. They put me on 6 in the hospital, but that just kind of bothered my GI system. So I took myself down to 4. Please don't do that. Get your doctor's get your doctor's advice. And prednisone, tacrolimus, and Cellcept. I'm on Cellcept, 1,500 milligrams twice a day.
Thank you, Aricia. Carrie, would you be willing to just quickly share what you take?
Sure. I take 100 milligrams of azathioprine, and I'm almost off prednisone. I'm taking 0.5 milligram on Tuesdays and Thursdays, and that's taken about 2.5 years. My numbers are really good. I also take ursodiol. And, I feel good with it. I don't have a lot of fatigue or anything. One of the things that's happening right now is my lymphocytes are low. They're trying to see what's going on with that. And I've got a couple things working there. So don't know if there's something else going on or it's because of the azathioprine.
Thank you, Carrie. And I'll just share briefly my own experience. I'm on a very low dose of azathioprine, just 25 milligrams. And I just share that because you can kind of see how individualized treatment is for this disease. And some patients like Aricia are on several different medications, and others like me are just on a very small dose of one medication. So just want to let all the newly diagnosed people know that it can look quite different for each person. One thing, our newly diagnosed support group, some of those folks are interested in hearing from more seasoned patients like all of you. What was the first year of having the disease like for you? Who would like to answer that first?
Sure, I can do that. For me, it was kind of a mental adjustment because I didn't have any, big symptoms, and it still is to some degree. I've had it 4.5 years. The other thing that was difficult, the first doctor I had was not really aware, or he hadn't really had many patients. And I think I actually got some bad med plans from him. So I did move after my first year. And I actually found him through the AIH registry, and he's been great.
Fantastic. Aricia, what was your first year like?
Oh my God. I could write a book about this. I tell you, I could go on and on and on, but I'll make it short for you guys. Okay. My first year, when I think back in 2016, I usually go for my, regular doctor's appointment checkups and everything. And when I went in 2016, my liver labs were elevated, AST, ALT, Billy. They were all elevated. They were in the 500, 600. So I went to my primary doctor. And so he just, asked me a couple questions. I've had trouble with insomnia. So I was taking a Tylenol PM over the counter. And he told me just stop taking the Tylenol PM, come back in the next 2 weeks, and so he can recheck my blood. And he did, and it was down. And then 2017 it's when I was diagnosed, which is basically when all the symptoms started, and everything. The first year was like a roller coaster for me. I mean, mentally, physically, emotionally. I was in the hospital just about every 3 months. My GI would try to wean my medicines down, my prednisone down. He weaned it down. My labs would go sky high in the thousands, 2,000s, 3,000s, very high. I mean, I was just so sick. I could barely get out of bed. Fatigue was severe. I couldn't walk 10 steps without just wanting to fall out. It was horrible. The visits to the hospital every 3 months, get out, just to start feeling a little bit better. Then boom, labs go back up. And it's kind of been like that, since then. I know this is the first year, but it was just so much to take in. And being a registered nurse, I worked in med surg, I worked in family practice. My specialty was in mother baby. I never heard of autoimmune hepatitis. So I was thinking in my head, where did this come from? I went to nursing school. They didn't cover this, they covered the regular cirrhosis and, fatty liver, but never autoimmune hepatitis. So when I was diagnosed right away. I went to my doctor. I was feeling really bad. I was on my way to work. I had to stop and throw up like 5 times. Nausea and vomiting set in. I was so tired. Went to a doctor's appointment. I'm sorry, this is graphic. When I went to the bathroom, when I peed, my urine was basically brown. Mm-hmm. My eyes were yellow. I worked in a clinic, and one of my providers said, "What's wrong with your eyes?" They were yellow. My skin was yellow. I thought I was having. I'm always thinking thoughts I have symptoms of gallbladder. Like my gallbladder is crazy, And so I went and got my labs drawn. I got a call the next day, go straight to the hospital. And that's when they start the process of basically diagnosing me. I got right away. They diagnosed me right away. I went for ultrasound. I went for the liver biopsy, and boom, they said, well, you have autoimmune hepatitis. What is that? Is what I was asking, like, what is that? I know autoimmune is, your body or your immune system attacking, something. But anyway, I mean, like I said, I could go on and on and on about this.
Thank you, Aricia.
I'm going to end it here for you guys.
Carol, what about you? What was your first year like?
Alicia, I hope I'm pronouncing your name right.
Aricia.
My first year, I was going to start off as saying it was a roller coaster, but compared to Aricia's, it was a very smaller, it was just like hers, but on a much smaller scale. When I had the acute flare in August, I had the nausea, sorry for the graphics, but the urine that was scary, and the total yellowness, because my bilirubin was like 20 almost, which is not good. But 60 milligrams of prednisone in 2 weeks, I recovered quite nicely. But then I relapsed, and I was doing fine for a couple of months. But then 5 months into my first year, I relapsed, and I think that was harder than the acute flare. Knowing that I had gotten to a certain point and then had to start back. with ground zero. So the first year was very, very rough. The second year has been frustrating because it's been so slow, but no big drama. I mean, I'm slowly but steadily tapering, and I am just dealing with the side effects as they come. And I'm grateful that I'm only on one immunosuppressant plus prednisone, because I hear that, people have to be on several, and I'm so grateful that I'm only having to deal with one. But yeah, the first year can be very scary. What would have helped a lot was to have had this group, but I couldn't find it. I'm not very good at navigating the web. If I had been able to find this group from the start, it might have been a little easier. But that first year I was flying blind totally, and I just did not. It was hard, very hard.
And one of our goals as an organization is to market ourselves a little bit better so patients can find us sooner in the diagnosis process. We would love for a doctor to diagnose a patient and then give them our newly created pamphlet about our organization so they can connect with us right away. I'd now like to move to any symptoms you all experience from the disease or side effects from the medications you take. Sometimes it can be difficult to distinguish between the two, but any symptoms or side effects you're experiencing, and any tips for other members about how you have successfully coped with them. Good question.
I could say I don't have a lot of side effects. I don't know whether prednisone, I've read that it can affect your ligaments and tendons and different parts of that. I did have an ankle injury that I had to have surgery on, during the period I was on prednisone, but I don't have really any of the fatigue or any of those types of things. I can tell that I'm on medication, but it doesn't seem to affect some of the stories I hear.
Oh my God, you are so lucky.
He is. Yeah.
You are so lucky. Let me start with my side effects and my symptoms from the medicine itself. Headaches. I think from the prednisone, blurred vision. When you get on the high doses of the prednisone, definitely nausea, vomiting, have that. GI problems, of course. Let's see, I get swelling in my ankles a lot. I'm not sure because some of the side effects kind of like coincide with the others. So sometimes you never know, which medicine is causing what. But yeah, and I have I had reflux before, but definitely when my liver is inflamed, my reflux is basically out of control, and my itching. And let's not talk about the severe fatigue that I have that just ravishes me on a daily basis. I am now like.
Can I interrupt you a minute? The fatigue, this is something we hear over and over again from patients. Have you found anything that helps? How do you deal with the fatigue? You're a registered nurse, you work, there's a lot of other working patients out there who are struggling to kind of deal with fatigue and working. And I just wondered if you had any tips for anyone.
For me, fatigue is an issue. It's a horrible issue for me. The way I cope with it is I rest. But my body predicts what my day is gonna be like. With the fatigue, sometimes I wake up with it. And I can, basically do nothing but like just sit around and just kind of take it easy. Try to not overexert, because once you do, it'll just last and last and last. And sometimes I wake up and the fatigue is not, really bad, and I'm able to get around and do things. So I'm just saying, the way to cope with it is when your body tell you to sit down. When your body tells you, look, I can't move, anything. I have trouble even taking a shower. Sometimes I can't stand up in the shower to take. So I got a chair so I can sit in the shower, because I would be just totally wiped out after taking a shower. That's how bad my fatigue gets. So, like I said, you rest, your body's going to tell you, you can't do anything else. This fatigue predicts what I'm going to do, on a daily basis. So, when I wake up and the fatigue says, no, you can't go anywhere today, I can't go anywhere that day. That's basically how I deal with it. Can I also say, Erin, I can also say, I forgot to mention with the prednisone, with the weight gain and everything, it causes the weight gain. And, my primary care always says, exercise, for weight gain. And so, sometimes not that I don't want to exercise, and I do like chair exercises and everything. And he's like, well, you need to get out and walk. And I look at him and I tell him, buddy, if you have fatigue like I have, you wouldn't be telling me this. I have tried to explain this to him over and over and over and over again, but he just doesn't get it. Of course, he's like, yeah, just get out and do a walk. When I'm telling you, I walk from my door to my driveway, which is probably about 20 steps, and I have to fall into the car and rest and and sit there and rest. That's how bad it is. So just everyone copes with it in their different way, but my body tells me when I need to sit down, when I need to relax, when I can't go anywhere, and then it tells me when I can. Yeah, this is a good day, hey, let's go out and get your scooter and go out and do some grocery shopping or something like that. So
that's great advice, taking cues from how you're feeling from the day and kind of adjusting your schedule accordingly. Carol, what about you? Do you experience fatigue as well?
Oh, it's not as, I can't describe it as eloquently as Arissa, but it is there. It's pervasive. And I get some days you get up and you're almost more tired in the morning than you were before you went to bed at night. Like what happened to me during my sleep? But I try and what helps me is I try to plan activities that make me, I'm retired, so I thankfully don't have to report to a job, but I try to plan some activities that make me at least get up and take a shower and get dressed. And then I just go on and do the best I can. I'm going to be slow. I can't get there early in the morning. And as far as walking, exercising is hard because the gyms, I really don't feel terribly safe in them at this point. But I have been seeking out some venues that are safer, that have climate controlled walking. I think, as cliche as it is, I think moderate exercise is probably the best thing you can do, to the extent that you can do it, because it helps you sleep better, and that in turn promotes more energy. But you're right, it's very hard to tease out what is a symptom from the med, what is a symptom from the AIH itself. It's very hard to figure out what's going on there. So that's a challenge. I agree with that. Absolutely.
Thank you, Carol. I think that's a good transition time. I'd like to go to our first poll question. Kelsey, if you could bring it up. So a reminder, these poll questions are anonymous. We don't say who answered what, but of this, from everyone here today who's a patient or representing their child who might be a patient, of all the symptoms that you or your child experience from autoimmune hepatitis, which one has the most significant impact on your daily life? And we listed 5 different ones that we hear from patients over and over again: fatigue, difficulty sleeping, anxiety and or depression, joint pain, or digestive symptoms. And I'm not sure if you can all see, I can kind of see the answers populating as people are answering here. We'll just give it another minute or two, then I will share the results. You people are still answering, but by far fatigue, over 50% of you are saying fatigue, and that does not surprise me in the least. It's something we hear over and over again in our support groups, and you've heard from the panelists today. So thank you for participating in our poll. I will go ahead and end the poll now, I think. And oh, I can share the results. Are you all able to see the results now?
Oh, yeah.
Okay, yep.
Yeah.
Great. Okay, I'm going to stop sharing that. I now like to move to another question to our panelists. This might be our last one. We could have, I think, easily gone an hour for this patient panel, and we'll have to take that feedback for next year. I'm just looking through my questions here. I think a good question to end on would be, what advice do you have for newly diagnosed patients?
I'd say, and yes, I definitely think we need an hour for this next year, Aaron. Let's try that happen. So let's see. What was the question again, Tom?
What, we are always trying to share information with newly diagnosed patients. That's when people need the most support. What advice would you have for other patients who have just recently been diagnosed with the disease?
Ask questions. I mean, when you go see your specialist, your GI, your HEP doctor, ask questions, because they're gonna know, they're gonna know the answer. Your primary care doctor is not gonna know a lot of the answers to these questions. I explained to my primary care doctor a lot about AIH and having AIH and everything, even though, when I tell him, it seems like, he might already know. I really don't think he knows. And I am definitely educating him on, from my aspect of the patient having autoimmune hepatitis. But I'd say, before you go to your specialist, before you see a specialist, write all the questions down. Do your research. Go to the library. Do your research. Definitely, and please describe all of your symptoms. It doesn't even matter if you think it's from autoimmune hepatitis. Every symptom that you have, because it could be coinciding with that and you don't know it. But if you don't ask the question, then their specialists can't put it in perspective for you. I tell you, when I go see my specialist, my GI HEP, I usually take my mom with me, and she's a heavy hitter there. She asks all the questions. She does a lot of research. And she just hits him with the questions, and she's awesome. She is a registered nurse also, and sometimes, with AIH, I don't know if everyone else does. I have brain fog sometimes, where I'm just thinking and like totally forget something that was just said to me, just explained to me, or something that I was doing, and I like stop in mid because I couldn't remember what I was doing. So I think the most important thing is write your questions down. Don't go, because if you don't write your questions down, then you'll forget, because it's a lot of information coming at you, and you will forget, the questions that you want to ask. So is just, the most important thing about it.
Write your questions down. We also heard from you, consider bringing a support person with you to your appointment, to not only ask questions, but listen and helped you to retain information. Carrie, what else would you add to that list?
Yeah, I think Risha hits a lot of points. Because there's such a lack of knowledge, just even in the medical community, you kind of feel lost. And having someone there to support you with questions, whatever. I was fortunate. The company I worked with had a rare disease division, and they'd never heard of it. So it's really difficult to get information. And they actually recommended the AIH, or looking for a support group. And that's how I ended up finding it early. I also think there's kind of I talk with different people that have had it, especially early on, and it almost feels like you got to chill a little bit, that, things will be okay. And it's very difficult to explain it to your friends and family. After you tell them, they go, well, how's your kidneys doing? Or, what's going on with your GI? They never get it right. So I kind of have to cut a break with people that way. And I'll get the, oh, you're still not drinking anymore, type of thing in social settings. So I kind of feel like there's some attitude adjustment you have to go with. Doesn't make it any easier being flippant about it. But, I think there's things that we can do I lean into my faith more. I love the Andy Dufresne quote from Shawshank Redemption. I don't know if you've ever seen that movie, but he talks about, that there's, a choice you make: get busy living or get busy dying.
Yes.
And, I think when you face sort of your mortality, things like that come up. So anyway, that's a little bit there, Erin.
Thank you, Carrie. Carol, what would you add to that list?
Again, writing the questions down. My specialist actually books in 20-minute intervals for her patients. So you got to not only ask them, but ask them very fast and be very, very excuse me, edit them down. And pinging off of what Carrie said, I wish people tell you this all the time, but probably it's real. If you can do it, calm down, try and calm down, because you'll be so stressed, and it's not the usual helpful resources. Friends and family may disappoint you because they are not going to understand this. You don't even really understand this until you've gotten it. And people will ask you things like, aren't you cured yet? Aren't you cured yet? What's wrong with you? And so that can be discouraging, but just, stick with like-minded souls and support groups, and gather as much information as you can. Your specialist is not going to have the time to do the research that you are, so anything that you can bring to them would be helpful, that for sure.